Welcome back at 6:30. Good Monday morning to you as we take a live look this morning at Del Valle High School. Today, the Central Texas Food Bank's hosting a drive-through food distribution here at the high school in Del Valle. The food bank helping families get through this tough time, putting food on their tables. You can see the cars lined up there. They will start handing that food out at 9 a.m. this morning. Of course, many in the community continuing to come together to help out during this very difficult time, and city leaders carefully making plans to move forward. We are thankful to have Austin Mayor Steve Adler staying with us this morning here on Daybreak to answer just a few more questions. Mayor, thank you so much. Let's get back to that food we were talking about. We've never seen anything like this in our community. No doubt food banks in desperate need of supplies. Are you happy and content with the way that is going, or do you see room for improvement when it comes to food distribution in Austin?
Well, there's certainly really great need, and we need more. We need more contributions, and we need some more support for the food bank. Obviously, looking at the number of people that are lining up, I'm real pleased with the infrastructure that we have in the city. We just have some great people and some great volunteers and a community that wants to respond. So we are assisting lots of people in lots of different places, in lots of different ways, getting food to eat. But it is a big challenge and will continue to be a big challenge, so we need continued support.
Mayor, we know there have been clusters of people testing positive for the coronavirus. We talked about that this morning on Daybreak. Places like senior living centers, the Salvation Army shelter downtown, more than half of the deaths in Austin connected to these clusters. What's the best way to deal with a cluster when it comes to this virus?
Well, the most important thing for us to be doing with respect to clusters is to isolate and to contact trace. So when we find the virus, we need to make sure that whoever it is that has it gets isolated. We have not done anything to make this virus less infectious. All we have done, and we've done it well, is decrease the number of physical interactions so that the virus can't spread. That's what you try to do with a cluster. A cluster is, by definition, a situation where you didn't get in quickly enough with that first case to stop it from spreading. But if it spreads to 2 or 3 or 4 people, then you need to isolate those 2, 3, 4 people so they have a chance to recover. You also have to make sure that you can determine and find who it is that those 2, 3, or 4 people came into close contact with, so that you can tell those people to isolate in case they have the virus so that they don't spread it. But you want to get testing to those people just as quickly as you can so that you can determine whether or not they have the virus and whether or not they could give the virus to someone else. That's the concern and the reason why, as you adapt businesses, you have to be able to do it in a way that does it slowly and gradually to help ensure that we are not compromising our ability to find the virus when it comes when it appears, and then to continue to isolate it so that it doesn't spread, and to contact trace it to make sure that we can find everybody who came into contact with it. If we have people starting to go to large groups, and if you ask them, hey, who have you been in touch with over the last 3 or 4 days, and if their answer to that question is, well, I don't really know, probably over the course of that day, 100, 200 people, it's going to be really difficult for us to isolate it and to contact trace it, and that's what we're looking at now.
Mayor Adler, with regard to testing and the enrollment form and portal that was announced by city leaders on Friday, do you have a percentage or a number in mind you would feel comfortable with when it comes to the number of people who are being tested in Austin and Travis County?
That's a question that I've asked the experts, and they're looking at that right now. We're trying to get out just as many tests as we possibly can to make sure that everybody who has symptoms anywhere has the ability to get a test, but also to be able to continue testing our first responders and the front care health workers, because if there's ever an infection there, we need to know that one right off the bat, because they come into contact with so many people and vulnerable people. But we also have to have enough tests to start testing those vulnerable populations, like in nursing homes or in shelters for people experiencing homelessness, maybe to go into communities where we're seeing a higher level of incidents than we might be seeing in other places, to really pay attention to our communities of color, because we know that we have a history that has put them at a disadvantage. What we're doing now with respect to testing is we're going to start opening it up to thousands more people every week. And the result of that testing, as we get to a larger and larger group of people, will also help us know how many tests we need to give.
Mayor Adler, one final question. I know the stay home, work safe order expires. The current one expires May the 8th. When will you be making a decision, if possible, to extend that? Do we have a few days, a couple of weeks before you would make that announcement?
Well, the county judge and I both have orders that both expire on May 8th. We did that purposefully so that it was past the expiration of the order of the president and the governor, both of whose orders expire at the end of April. That will give us time then to react to whatever their order changes are. But this is not something that's going to be over quickly. And until there's a vaccine that can actually protect people, then people will continue to be at risk. This is just as infectious a virus today as it was when we started this earlier in March. So this is going to take time. As we go forward, we're going to be able to adapt what we do, but the extent to which we do it is going to be governed by, needs to be governed by the science and the data to help ensure, like the pandemic, the flu in 1918, that we don't feel good about having separated and thus stopped the transfer of the virus, only then to stop the separation in a way that brings the virus back even more ferocious than it might have come the first time. So that's what we're working on. We don't know and can't know a lot about the future. We do know about today, and we have control over today. And that's why we need people today to continue to social distance, to continue wearing masks when they go out, to continue to stay 6 feet apart. That's what we can control right now.
Mayor Steve Adler, thank you so much for your time this morning, spending several minutes with us here on Daybreak. Thank you for being with us.